Hello, my name is Dr. Dewan S. Raja. Today I will discuss multiple choice questions on the anatomy of the spinal cord. Let's start. Question number 1. A 45-year-old man presents with bilateral loss of pain and temperature sensation in a cape-like distribution over the shoulder and upper arms. Motor function and proprioception are preserved. Which of the following spinal cord structure is most likely affected? So, bilateral loss of pain and temperature, sensation in a cape-like distribution over the shoulder and upper arms, motor function and proprioceptions are preserved. Which of the following spinal cord structure is most likely affected? We have choices are A. Anterior white commissure, B. Lateral corticospinal tract, C. Anterior horn, D. Dorsal column, E. Spinocerebellar tract. This is a typical case of syringomyelia cavity in the spinal cord, center of the spinal cord, and here it will affect the anterior white commissure. So this is the side. Okay, the syringomyelia will involve this part, that is anterior white commissure, and that is the feature of this presentation. So answer should be A, anterior white commissure. Question number 2. A 25-year-old male is involved in a motorcycle accident and sustains a hemisection of the spinal cord at T10. Which of the following finding is expected on the ipsilateral side of the lesion? A. Loss of pain and temperature sensation below T10. B. Loss of proprioception and vibration sensation below T10. C. Spastic paralysis below T10. So here we have two choices, B and C. Answer should be D here, both B and C. This is a typical case of Brown-Séquard syndrome. So answer is D. Question number 3. A newborn is diagnosed with myelomeningocele. Examination shows flaccid paralysis in the lower limbs and absent deep tendon reflexes. Which part of the spinal cord is most likely damaged? A. Dorsal column, B. Anterior horn cells, C. Lateral corticospinal tract, D. Spinothalamic tract, E. Posterior horn. We have flaccid paralysis, okay, lower motor neuron lesion, and absent deep tendon reflexes. Answer should be B. Anterior horn cells. Anterior horn cells. Okay, question number 4. A 35-year-old woman presents with progressive weakness, spasticity in both legs, and urinary incontinence. MRI reveals demyelination in the spinal cord. Which disease is most likely responsible? A. Guillain-Barré syndrome, B. Amyotrophic lateral sclerosis, C. Poliomyelitis, D. Tabes dorsalis, E. Multiple sclerosis. We have demyelination of the central nervous system, so our answer should be multiple sclerosis. E is the answer, multiple sclerosis. Number 5, a patient presents with progressive difficulty in walking and frequent falls. Examination reveals loss of vibration and proprioception, a positive Romberg sign, and absent deep tendon reflexes. Which condition is most likely? A. Syringomyelia, B. ALS, C. Tabes dorsalis, D. Anterior spinal artery syndrome, E. Guillain-Barré syndrome. Answer should be C. Tabes dorsalis. There is a feature of tertiary. This is tertiary syphilis, and features are this posterior column involvement, loss of vibration proprioception, Romberg sign. Posterior column involvement may go to the cerebellum, and there is absent deep tendon reflexes. These are features of tabes dorsalis. Answer is C. Question number 6. A 40-year-old man with a history of polio as a child presents with progressive muscle weakness in his lower limb. No sensory loss is noted. Which part of the spinal cord was initially affected? Lateral corticospinal tract, anterior horn cells, C. Dorsal column, D. Spinothalamic tract, E. Central gray matter. Answer should be B. Anterior horn cell. It is lost in poliomyelitis, and that will lead to shrinkage of the muscle and limbs will be shorter. Okay. Question number 7. A 55-year-old man presents with progressive spastic weakness in both lower limbs and hyperreflexia. There is no sensory loss. Which spinal cord structure is most likely involved? A. Dorsal column, B. Anterior horn cell, C. Lateral corticospinal tract, D. Spinothalamic tract, E. Central gray matter. Answer should be C. Lateral corticospinal tract. We have spastic paralysis, weakness, lower limb, and hyperreflexia, features of upper motor neuron lesion. That is the lateral spinothalamic tract. Question number 8. A 70-year-old man with chronic back pain and recent onset of bowel and bladder incontinence is found to have bilateral leg weakness and loss of perianal sensation. Which condition is most likely? Brown-Sequard syndrome, Conus medullary syndrome, Coda equina syndrome, anterior spinal artery syndrome, multiple sclerosis. Answer should be Coda equina syndrome. A 50-year-old woman presents with weakness in her right arm and leg, along with tongue deviation to the left. Okay. MRI shows an infarct in the medulla. Which tract is affected? Okay. Spinothalamic tract, corticospinal tract, dorsal column, spinocerebellar tract, medial lemniscus. We have weakness, right arm, right leg, along with tongue deviation to the left, that is the hypoglossal nerve is damaged and it is deviated towards the left. So this is a feature of medial medullary syndrome. Okay, so which tract is affected? That is the corticospinal tract. This is the answer. B is the answer. Number 10. Okay, B. We got that B. Number 10. A 62-year-old man with history of atherosclerosis suddenly develops weakness in both lower limbs. On examination, he has spastic paralysis, loss of pain and temperature sensation below the umbilicus, and preserved vibration and proprioception. Which artery is most likely occluded? Typical picture of what? A. Anterior spinal artery, B. Radicular artery, C. Posterior spinal artery, basilar artery, vertebral artery. We have the findings: spastic paresis, loss of pain and temperature, that is spinothalamic tract, corticospinal tract, and spinothalamic tract are affected. Our answer should be anterior spinal artery. Okay, because we have preserved vibration proprioception, posterior column is not lost. So answer should be anterior spinal artery. That is the problem. A is the answer. Number 11, a 45-year-old woman undergoes thoracic aortic surgery. Post-operatively, she developed flaccid paralysis of both legs, loss of pain and temperature sensation below the level of T8, and urinary retention. Proprioception vibration sense remain intact, which spinal cord structure is most likely spared. Which spinal cord structure is most likely spared? A. Corticospinal tract, B. Spinothalamic tract, D. Dorsal column, C. Dorsal column, D. Anterior horn cells, E. Anterior white commissure. Answer should be the dorsal column. Okay, because proprioception and vibration sense remain intact. Question number 12. A 48-year-old man with history of untreated syphilis presents with difficulty walking at night and severe stabbing pain in his leg. Neurological examination shows wide-based gait, absent knee and ankle reflexes, and urinary incontinence. Which of the following is the best confirmatory test for the suspected diagnosis? This person has tertiary syphilis, that is the tabes dorsalis type of tertiary syphilis, and the best diagnosis process or best confirmatory test is the CSF BDRL test. BDRL stands for Venereal Disease Research Laboratory. So this test will be more specific for this person. And that's all about the MCQs on the anatomy of the spinal cord. If you have any question, please feel free to ask me. Please share the information with your friends. Please support my channel. Please subscribe me. Have a nice, wonderful, and blessed day. Bye now.